Hi, I'm Liz and I'm a dietetic assistant at the East Midlands Bariatric and Metabolic Institute. This video should provide you with the information you need to know about the pre-op diet and your upcoming bariatric surgery. Why do you need to follow a pre-operative diet? During your operation, the surgeon will need to move your liver out of the way in order to gain access to your stomach. By following this diet, it will cause the liver to shrink, ensuring that it can be safely moved aside during the operation. However, if you do not follow this pre-op diet accurately, then there is a risk that your liver will not shrink enough, or your liver will be too large and your surgeon will not be able to go ahead with the operation. Generally, the pre-op diet will last between 2 to 6 weeks, but this will be specified by the surgeon before you start the diet. The pre-op diet contains less than 900 calories and less than 100 grams of carbohydrates per day, and this will last for the duration of the diet. The pre-op diet has two options to choose from. Option A, 900 calorie food plan, and option B, 900 calorie meal replacement plan. Please be mindful that if you choose option B, you could be following a liquid diet for a minimum of 4 weeks, as you will also follow a liquid diet for 2 weeks after your procedure. It is your choice which of these options you choose to follow. We recommend following one option for the entire duration. However, if needed, you can switch between both options. If you do this, it is essential that you follow your chosen option for one whole day as a minimum before moving on to another option. You should not include both options within the same day. We typically recommend following the meal replacement plan where possible, as this guarantees the correct calorie and carbohydrate content. We will go through the different options for the pre-op diet. Option A, 900 calorie food plan. This plan includes 3 meals per day and 2 portions of fruit for snacks. Each meal has a specified portion size for protein, carbohydrates and vegetables. You also have a dairy allowance of half a pint of skim milk and 1 small pot of fat-free yogurt, or 1 pint of skim milk. If you are lactose intolerant or sensitive to cow's milk, the best alternative is lactose-free milk or soya milk. Other plant-based milks such as almond, oat and cashew milk are not suitable as they contain too little protein. You should also aim to have at least 2 litres or 4 to 5 pints of calorie-free fluid per day. This includes water, tea, coffee and no added sugar squash. If you choose to add milk to your hot drinks, this should come from your dairy milk allowance. If you choose to do this plan, you will need to take a daily multivitamin as well. During the pre-op diet, it is important that you use scales to measure portions accurately. Avoid alcohol and fizzy drinks during this time, and to try and vary foods as much as possible. However, do not add any extra sauces, oils or sugars to the diet, as this can increase the calorie consumed and could result on the food plan not working. You can flavour your food with small amounts of calorie-free options such as salt, pepper, vinegar, spices and herbs. Option B, 900 calorie meal replacement plan. For this plan, you will need to be having 3 meal replacement products per day. These may include shakes, soups or meal bars and can either be pre-made or as a powder. Each meal replacement product should contain between 200 and 250 calories and between 15 to 20 grams of protein per serving. Some examples of these are Slim Fast, Complan or supermarket own brands such as Tesco Slim. Please be aware that these products need to be a meal replacement product and not purely a protein supplement. As well as the meal replacements, you can have 2 portions of fruit as snacks per day and have a dairy allowance of 200 ml of skim milk per day. This milk allowance does not include the milk that is added to make the meal replacement shakes. Please ensure, whilst you are doing this plan, that you consume at least 2 litres or 4 to 5 pints of calorie-free fluid per day. Again, this includes water, tea, coffee and no added sugar squash. If you choose to add milk to your hot drinks, this should come from your dairy milk allowance. You may experience some constipation when following a meal replacement diet. Please ensure you are drinking plenty of calorie-free fluid each day. If that does not help, you may wish to try a laxative bulking agent such as fibre gel, available from most pharmacists. However, this should not be used after bariatric surgery. Although it can take 2 weeks for the liver to shrink in size, it can regain its size also immediately after one high-calorie, high-carbohydrate meal. It is essential that you stick to the pre-op diet strictly for the time specified to give you the best chance of a successful surgery. Do not be tempted to have one final treat meal before your surgery. All the information discussed in this video is available on our pre-op diet information sheet. This is where you will find all the weights and measurements for each meal. If you have any questions about the pre-op diet, please use the contact details provided on the information sheet.